Good morning. My name is Nancy Alexis, and my presentation is about South Africa. South Africa has gained its independence back in May 21st, 1910, and in April 1994, that's when it has become a democratic country. South Africa is located in the southernmost region of Africa. This country has three cities that serve as capitals. They have the Pretoria, the Cape Town, and the Bloemfontein, which is considered a judicial city. Because of their diversity, this country has 11 official languages. The culture of South Africa is one of the most diverse in the world. Majority of the South Africans still live in the rural area where culture tradition has survived, about 80% of South African. Some of the prominent culture of South Africa include the Khoikhoi, the San culture, the Zulu, the Kebele, the Xhosa, and Soto culture, among other cultures. South African tradition is not homogeneous, but a blend of different tradition and culture practiced by different ethnic groups in the country. South Africa is called the Rainbow Nation because of its variety of people, culture, and religion. Ethnic group, they have Black African, White African, Colored African, and Indian and Asian African. In South Africa, the Constitution protects freedom of religion. Everyone is free to follow whatever doctrine that you want. Even if you don't want any, it's fine. But Christianity is the main religion for South Africa. But like any other country, they do have other religions, other pride that they do observe. South African healthcare system consists of a large public sector and small yet fast-growing private sector. Basic primary care healthcare is offered free to all residents in the country, according to the Holtz book. Highly specialized high-tech care are limited to only those who can afford private care. The government contributes about 40% of the healthcare costs for the public care. However, they have 80% of the population use it, so it is already overcrowded. South Africa is considered a middle income country, yet its disease rate is higher than those of many low income countries. Some of the main problems related to health including poverty related to illness such as infectious disease, HIV/AIDS, TB, malaria, maternal and child mortality, malnutrition, high rate of non-communicable disease. Child mortality has increased over the years, 36 to 1,000 births. Less than 15% of the population use health care. Yet, 46% of all healthcare expenditure are devoted to private healthcare service. There is a disparity among the fund, the province within the country. So the distribution for the supplies and the funds are not done properly. The 10 top causes of death of South Africa, there are tuberculosis, diabetes, other form of heart disease, cerebrovascular disease, HIV, hypertensive disease, influenza and pneumonia, other viral disease, ischemia heart disease, and chronic lower respiratory disease, according to the CDC. And for the children under the age of 5, the main cause of death, they are HIV and AIDS, low birth rate, diarrhea, lower respiratory infection, protein energy malnutrition, neonatal infection, birth asphyxia or birth trauma, congenital heart disease, road traffic accident, and bacterial meningitis. And the country is facing a lot of challenging in healthcare for the healthcare access. Provider to population ratio is 0.77 for 1,000 people in the population. Most providers, about 70%, work in the private sector. There is just about one practicing doctor for every 4,219 patients. South Africa is the third country with the highest burden of TB. Approximately 500,000 women are raped each year. 50% of female victims are killed by either the spouse or the partners, according to Good Home. The country is ranked by the UN as the second in the world for murder and first for assault and rape. Majority of nurses work in the private sector because they pay better and they offer better benefits. Other healthcare professionals, they'll migrate to the United States or the United Kingdom trying to have a better life. Providing nursing care has become very challenging because there is a lack of nursing, especially in the public sector. And the repartition of supplies are done unevenly. That has created a challenge too, especially in the public sector, to really offer nursing care. But they do have a road to recovery. To improve the shortage of medical doctors, the country has signed a contract with Cuba where Cuba are sending them the doctors, and they're sending their medical students to Cuba so they can learn medicine too. The life expectancy have been increased over the year because of the HIV/AIDS and the TB treatment that they have going on now, and the government is planning to investing more in the public sector in the rural area. Thank you. That's all that I have.